In this video, we will review everything what you have to know about zinc and zinc deficiency for examination. Zinc is an essential element in our body, and the major function of zinc is to serve as a cofactor for enzymes. So let's explain the biological role of zinc and the pathogenesis of zinc deficiency. First of all, we have to know the pathway of zinc in our body. We intake zinc through the diet, mostly by consumption of red meat and grains. After this, zinc comes to our stomach, where parietal cells, by secretion of hydrochloric acid, digest meat with release of zinc. After this, zinc comes to the duodenum, where absorption occurs. Duodenal enterocytes, through the ZIP4 and divalent metal transporter, absorb zinc from the intestinal lumen. And after zinc comes to the duodenal enterocytes release zinc into the blood, where zinc binds to albumins. And in this binded form, zinc is transported to the liver. Liver is the major storage site of zinc, but when tissues require zinc, liver releases zinc into the blood, where once again zinc binds to albumins, and in this binded form, albumins transport zinc to the tissues, where zinc provides enzymatic and non-enzymatic functions. So let's explain the functions of zinc in more details. The major function of zinc is enzymatic, because zinc is an important cofactor for enzymes in our body. First of all, we need zinc for a proper function of DNA and RNA polymerase, which are essential enzymes for cellular proliferation. And these enzymes are especially important in rapidly dividing cells, its epithelial cells of GI tract, of skin and hair follicles. Also, we need zinc for zinc fingers and transcription factors, which are essential for gene expression. Basically, without them, we cannot make proteins. Also, we need zinc for superoxide dismutase, which is an important enzyme in antioxidant defense. Zinc is a cofactor of alkaline phosphatase, which is an important diagnostic enzyme. Also, we need zinc for thymolin activity, and thymolin is an essential enzyme for T-cell maturation and differentiation. Zinc is also required for zinc-dependent hormones. First of all, it's insulin, because we need zinc for hexameric or so-called storage form of insulin. Also, we need zinc for insulin-like growth factor 1 secretion, which is important for growth of organism. And we need zinc for sex hormone secretion, which is essential for a reproductive function. Zinc also is a cofactor for carbonic anhydrase 4, which is a specific enzyme located in the taste buds, and this enzyme provides normal taste sensation. Also, zinc has non-enzymatic function. Zinc modulates GABA and glutamate receptor activity, which is important for our cognitive function. So, what are the causes of zinc deficiency? The most obvious cause of zinc deficiency is lack of zinc in the diet due to the malnutrition or starvation. The second cause is achlorhydria. Basically, in this case, the amount of parietal cells decrease, for example, in case of gastric resection, or the activity of parietal cells decrease, for example, during proton pump inhibitors therapy. In both this scenario, the production of hydrochloric acid by parietal cells decrease, which can disrupt the release of free zinc from the consumed products. The intake of tannins, together with zinc-containing products, can be one of the factors contributing to zinc deficiency, because tannins bind to zinc with formation of stable complexes. And the problem is that in form of complex, enterocytes cannot absorb zinc. The most high yield for examination purposes cause of zinc deficiency is acrodermatitis enteropathica. In this case, genetic mutation disrupts the function of ZIP4 transporter, and without this transporter, the absorption of zinc decreases, which leads to zinc deficiency. Also, we have to know that intake of calcium or iron-containing products can inhibit the absorption of zinc, because all divalent metal ions are absorbed by the same divalent metal ion transporter. So basically, all divalent metal ions are competitive inhibitors of each other. In addition to this, disorders which affect duodenum, as celiac disease or tropical sprue, potentially can also cause zinc deficiency, because they cause damage to enterocytes, which will cause decrease in zinc absorption. Because liver is a major storage site of zinc, chronic liver injury can also potentially cause depletion of zinc stores in our organism, which is especially relevant for patients with cirrhosis. All these conditions eventually lead to zinc deficiency in tissues, and with zinc deficiency, enzymatic and non-enzymatic zinc functions becomes compromised, which will cause clinical symptoms. With zinc deficiency, the function of RNA and DNA polymerase decrease, which leads to decrease in cellular proliferation. This typically manifests as dermatitis, diarrhea, and hair loss. Without zinc, the function of zinc fingers and transcriptive factors decrease, which affects protein synthesis, and this manifests as growth retardation and delayed wound healing. Without zinc, superoxide dismutase do not work. This compromises antioxidant defense and leads to oxidative injury, which creates pro-inflammatory state. Also, without zinc, the activity of alkaline phosphatase decreases, which manifests as decrease in concentration of alkaline phosphatase in the blood. This feature is unique and can be used for diagnosis of zinc deficiency. Without zinc, thymolin activity decreases, which disrupts T-cell maturation and differentiation. This leads to thymic atrophy and immune dysfunction, which is also a characteristic feature of zinc deficiency. With zinc deficiency, the secretion of zinc-dependent hormones decrease. With decrease in insulin, glucose intolerance develops. Decrease in insulin-like growth factor 1 secretion leads to decrease in growth and decrease in muscle mass, and decrease in sex hormone secretion leads to hypogonadism. Without zinc, the function of carbonic anhydrase enzyme becomes compromised. This leads to altered taste, a condition known as dysgeusia. Also, with zinc deficiency, the function of GABA and glutamate receptors becomes compromised, which leads to decrease in cognitive functions, and most commonly this manifests as depression or seizures. Here we can see a summary of zinc deficiency symptoms. The pathogenesis of each of them we've covered, so it should be easier for you. Hope you like the video, press like and hit subscribe button, and may the force be with you.